Innovative academic practice partnerships at the specialty level is our episode topic. My guest is Dr. Linda Zeman, Senior Director of Nursing Inpatient Services at Hospital of Special Surgery in New York, New York, and Cold Iron Senior Nurse Executive at Francis Payne Bolton School of Nursing, Case Western Reserve University. Linda is primary author of a 2024 article in Nurse Leader titled Pathway to Emergency Nursing, an Innovative Academic Practice Partnership. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Shimolewski.
Linda, welcome so much and thank you for joining us today.
Thank you, Nick. I'm happy to be here.
Before we get into our episode topic, can you share a little bit about yourself with our listeners?
I have a lot of background in children's hospital leadership, emergency department leadership, nursing operations, and the business side of healthcare. Most recently, I've been involved in some nursing education as an adjunct faculty member. So really looking at all aspects of nursing workforce optimization.
And workforce optimization certainly is a hot topic right now. As a nurse leader, what's one thing that's keeping you up right now at night?
What's interesting is that as I look back over my career, there's been various nursing shortages and there's been a lot of changes to the nursing workforce in terms of educational backgrounds required. As Magna's come forward, we've changed our nursing educational requirements. But I think one of the most difficult things we have faced lately is regarding the impact of the pandemic on the nursing workforce. We've seen significant changes in that. So what's keeping me up at night and had kept me up at night, specifically during the pandemic, is as we saw a change in how nurses were being educated, trained, and having their clinical time, we really needed to look at, are nurses prepared when they enter the workforce if they haven't had the requisite either amount of time or exposure? So that was something that was very often keeping me up at night. And how do we really bridge that gap as nurses peri-pandemic? Because I will say post. I mean, we're post-pandemic, but we're not post-COVID sometimes. We still are seeing a significant amount of that. But how do we make sure that we bring nurses into the workforce that are well prepared, especially new graduates, since we've had such an overwhelming amount of nurses either leave the workforce in general, leave nursing, or leave critical care and ED. So we saw a very significant uptick in those areas.
Our topic today is about academic practice partnerships. And just to level set for all of our listeners, what exactly are we talking about when we use the words academic practice partnership?
We're talking about those partnerships between academic health systems and hospitals and nursing schools. So how do we have those partnerships between those entities so that we're looking at the academic preparation of nursing students and their entry into practice? How do we best prepare them? And that partnership is where we see that happening.
The article that you co-authored and were primary author on, we'll get to in a moment, but I do want to highlight one specific thing because your article goes into the specialty of emergency nursing practice, and I understand that you practice in New York State. What specific practice requirements exist in New York when we're talking about emergency nursing?
So there was a period of time when New York State had required that nurses had to have 1 year of nursing experience prior to practicing independently in emergency departments. The appreciation of the high risk, high patient safety, vulnerability in those areas. And that was changed in 2019, immediately prior to the pandemic. So that really made a significant change in how we had to think about our preparation for emergency department nurses.
And so can you talk a little bit about your article, the need for this academic practice partnership at the specialty level and how this program developed?
So when we looked at the need, we had a lot of nurses leaving emergency departments, critical care areas, but specifically with the emergency departments, we've not had a huge amount of new graduate nurses. But when we looked at the gap between the number of staff that we had and the fact that the patient volume was significantly increasing, we really had to bridge that gap. And we were looking at the new graduate nurses that we had had come into our orientation and talk to other hospitals across the country. And folks were reporting that they were seeing a 40 to 50% turnover rate of emergency department nurses as new grads. So we jokingly would say the emergency departments are not like you see on TV. We realized that we had an opportunity here and we really had to better prepare our nurses because not only was it challenging for the nurses coming on board as new nurses, when nurses turn over, aside from it being costly, it's also a vulnerability for safety for our patients, but it also really impacts the current nursing staff who's retained. So nurses that have to continue to orient, they give their heart and soul to make sure these nurses are successful. And then when they turn over and over again, it's very dissatisfying for the staff themselves. And as we continue to, turn over a lot of nurses, again, that leaves a patient safety vulnerability because we want to have nurses that are building upon their knowledge, skills, and expertise. And when you're constantly bringing in new nurses, it's almost like you're starting over and over again. It's a little bit of a groundhog's day. So we had in our academic health system, we had created a nursing leadership council across all of our emergency departments. And we spent a lot of time standardizing the orientation, but several of us had had a conversation about, how are we going to decrease this turnover? How are we going to make a difference? Who is doing well on orientation and who is staying? And when we looked at that, what we appreciated was that the nurses that were able to come into the organization that had had experience and exposure in an emergency department, either as a capstone or an externship, they were doing much better in terms of their confidence. They were achieving their competencies and milestones much more quickly, and they were less likely to turn over. That was our anecdotal experience. So we began looking for those types of nurses, but that was a very few. We realized we had to get out into the community in one way or another to reach folks so that they would understand emergency nursing. And we had always had a partnership with this organization, the university that was affiliated, nursing school that was affiliated with this academic health system. And we had done a lot of work together on various things. But we talked about how could we partner so that we could have a nursing elective for emergency nursing. But even more importantly, because many nursing electives, in fact, most do not have a clinical component. So fortunately, one of the professors there was an emergency nurse. So he understood very well the situation in the state of New York, as well as what it was like to work in an emergency department in an academic urban medical center. So we worked with the School of Nursing, and we used the nursing leadership component, clinical component, and we partnered it with this. Now, this was a very significant difference for this academic health system. We had not had nursing students in any of our emergency departments. In fact, why would we have when there was a state requirement that you had to have a year of nursing experience? So that wasn't something that we had done. So that's how we sort of came up with this idea, this innovative idea out of necessity. So we wanted to make sure that we were creating something that was going to be enduring and provide nurses that were better prepared in terms of not only their understanding of ED, but also their confidence in the flow and environment of an emergency department, which ultimately would allow us to provide safer care.
So what are so I hear what you're saying is we're exposing student nurses to the emergency department during, the latter part of their program as they're getting close to graduation. What are the specific mechanics to that? Are they self-selecting into an emergency nursing course per se? Is there an evaluation that goes on of, hey, this person seems like a good fit? I'm assuming the hiring is separate from the studying itself, but can you walk me through those mechanics?
What you're implying is absolutely true. So the first time that we did this, which was last spring, we wanted to do it in a very controlled manner and have 12 students so that we could understand how this was going to work, introduce it slowly because we wanted to be successful and work out the kinks because this had not been done before in our system. So we did have a process where they had to apply for this pilot program, and they did. We took 12 students, all of whom were stellar, and had an interest in emergency nursing. And what we did was we wanted to create a program that was different. And so what we did was we met with the educators from two of the hospitals that we were going to be piloting this in and having, so all of the students met together for their didactic in a hospital setting. So it was in a conference room. We wanted them to come in, feel what it's like to come into a hospital, and we would have the didactic sessions in person. They did their clinical time at either one of the sites. And we wanted to create a curriculum that was really meaningful. And remember, we had a little bit of latitude because this was an elective. So we had a 3-hour session every week. And the majority of the time, we would have a session with a didactic part, a hands-on section, and very often, like the staff who came from the emergency departments would then be the speaker. So depending on the topic, we were engaging folks from all aspects of the emergency department. So we sort of loosely followed how the ENA CEN curriculum is in terms of categories and topics. We focused on, having a smaller didactic section, but really we wanted the specialists to come and speak to the nurses. And that's the part that they really enjoyed. It influenced them in their decision making. So we would have the respiratory therapist. We would talk about the didactics of respiratory care. And then we had a respiratory therapist who was incredible. She came with a ventilator. She came with equipment, and they would touch and feel and talk about it. But what was even better than just all of the, very often we're very PowerPoint heavy in nursing schools at this point, and there's a lot of lectures. They could have conversations, and it honestly was one of the best respiratory lectures I've ever heard. And I've been in critical care for a very long time. The students were even asking, they were pulling things from other aspects of the discussions because they were in person, they were experts in the field, and they would ask, like, so we know what we should do for tidal volume, but what do you do if the patient's this or that, or this is going on? And they were really able to use their critical thinking skills and get the feedback from the experts. We even had folks from emergency management come and talk about what mass casualty event. You need to understand that when you work in an emergency department. So they went through the logistics of that. We had bariatric nursing specialists. How do you take care of a bariatric patient? And they showed them the equipment and how you have to look at the equipment and assess the equipment. So it was very interactive. We had nurses, the forensic nurses coming, the safe nurses came, and they spent a very long time talking about not just the science of it, but the legal aspects of dealing with patients that are victims of sexual assault, the psychological aspects of it. They went through how to, what the kits look like, how they have to be stored, and the students were incredibly engaged because they were touching it, seeing it, and feeling it, not just seeing it on a PowerPoint where they could zone out and think of something else. Everyone was paying attention, engaged, asking questions, putting forth scenarios, and we got a tremendous amount of positive feedback from the students.
So I heard you say that it was 3 hours. I'm assuming a 3-hour elective course over the term of the semester. Was there a clinical component as well? And if so,
Yes.
did those clinical hours contribute to the minimum clinical hours for the degree completion program? I'm just trying to understand how
Yes,
that
it
fits
did.
in, since I mean, usually an elective is just the didactic component, but you're carving out clinical hours as well, correct?
Exactly. So that's why um, the full-time professor from this College of Nursing was so incredibly helpful, having been an active emergency department nurse, and he had other classes, and he also taught the nursing leadership class in that institution, and he took the leadership clinical component, and we used that for the ED elective. So the students then did have a clinical component, and it did count towards their program requirements because it was part of the program. So we also had the clinical instructors were actually employees of those emergency departments, and they were very involved and engaged. And we shared with them all of the materials that we had gone over, and they would, reinforce and look for patients that were those types of patients that we had discussed either the week before or something.
So what were your outcomes from this program?
We didn't do it as a full blown research study because it sort of as it evolved, it was fairly quick. So we didn't set up a pre assessment, but the evaluations from the class were incredible. But we did not use them in our in the paper. But we did go back because it was a small cohort. We got IRB approval to go back and ask a small subset of questions, and we had 100%. Yes, it was only 12 students, but we had 100% feedback from the student, and all of them responded that they learned a great deal and they felt that it was helpful in their decision making. And many, many of them, all of them except for one, had already found a position, one of whom had sort of chosen not to take a position at that time. So they were very happy about it being in the hospital because we looked at that too. So did we want to continue? So now we have approval to make this a full time, a permanent part of the curriculum for the school as an elective, but it's a fully approved elective. 73% of them actually did get emergency department roles. And they also appreciated the hands-on clinical aspect of it, the hands-on part that being tied to it. And they liked the multidisciplinary aspect of it. And they had the opportunity to speak to the people who were actually doing this every day. So I think that was incredibly valuable. And they would anecdotally report that. So qualitatively, they reported that having physicians come, we would have nurse physician partners come and talk about sepsis or something else together. So they reported that as being very helpful and that it was a very different curriculum for them. And they felt that it was more helpful for them to have the didactic portion. Everybody loves a good PowerPoint, but then talk to the people who are providing the care and ask them those questions that you can't really glean out of a PowerPoint discussion or a textbook.
Now that's 73% of those students were retained in emergency nursing in that organization. Did I understand that correctly?
They were not all in that organization.
Okay, but
Some
73 did stay in emergency nursing, so to
in
speak.
emergency nursing.
Do we know how many were in that organization versus
So
outside?
64% of them accepted within that organization.
Okay,
Anecdotally, this was not part of the
sure.
survey, that the one or two that took other positions were related to location or shift.
Okay, fair enough. And of those 64%, that study was the time frame was about a year ago. So, now a year later, do we know how many of them are still employed in their positions? Is there a plan to go back and look at that on a longitudinal basis?
That's a great idea. We haven't necessarily planned that.
Okay.
But I will be honest, I do keep in touch with them.
Yeah.
It was a wonderful group. And they, remember too, some of the opportunity that we had with this is these are nurses that are just learning how to, well, they weren't quite nurses yet, but they
Nursing
almost were.
students. Yeah.
They all passed their NCLEXs and they did
Awesome.
incredibly well. Yeah, that was great. So, but they all circled back and let me know, but because they had a lot of questions. And that's why this this forum was so great because we would often stay a few minutes late, and the nurse educators would stay after and talk to them about, like, how do you apply for a job? And we would talk about how you interview for a job. And yes, they get that information in school, but they were having these face to face conversations with us. So they were talking to the clinical educator in an emergency department who would be the person organizing their orientation. They were speaking to me, who would be someone who was working with the hiring managers. So they were able to really get that very proximal to their applying. It was their last semester. But it was that conversation with the people that they would literally be involved with. And I think that is something that maybe isn't captured, but also was something that supported the students. I did reach out to them all recently, and the ones that were able to respond are very happy in their roles and are still employed in their original positions.
I think it's gonna be really interesting to see maybe a year or 2 years from now where you're at, but where my mind is going if I'm a nurse executive is, gosh, I can set up these academic practice partnerships even at the specialty level. Because so often we think more globally of we're just gonna have a relationship with this school, not necessarily, you know, at the for the ORs or for labor and delivery, and get these students where we think that they're interested into those areas and let them self-select in or self-select out before we're even making a hiring decision. And you talked about the one student that figured out that, hey, emergency nursing may not be for them. Great. That cost the organization nothing. I mean,
Right.
they had a learning experience. It didn't cost the organization anything by hiring them and training them and then having them go somewhere else. And it sounds like they're having a wonderful experience. Equally important, they're getting all this knowledge before they have their license and they're out there practicing on their own. And you've potentially got a mechanism to retain them for a long-term basis.
Exactly, Nick. They're going in eyes wide open. They've literally been in emergency departments, they've seen it, and they can select, oh, I do want to be there. This makes me excited. I
Or it's
love
not
this.
for
This is
me.
great.
Yeah.
Or it's not for me.
Yeah.
I think there's absolute scalability for this for other specialties. Um, and I would include med surg as a specialty. I think that's sometimes the unsung hero of nursing. And we have to think about that type of thing moving forward. The other piece that, and I have been asked, and we are looking at, again, the portability of this type of thing. How do we do this with other schools, other organizations? So I'm actually hoping to meet with folks. We have some meetings set up preliminarily to talk about having some clinical time, not for this particular school, but another school in areas of underserved patient populations, because we need to make sure that students get that exposure. And those are the folks that really do need that. And very often, those hospitals don't have the finances to support a longer orientation or to tolerate the level of turnover. So I would say that that's even more important for them to really have students that are coming in, new graduate nurses that know what they're going to get into to reduce turnover.
Aside from the, hey, we think we have a winner here, we need to expand this into other specialties and greater partnerships with schools. What other lessons do you think were learned from this program?
So, what I've heard from the students is it's incredibly important to talk to the people that do the work. They were so excited to speak to the respiratory therapist to hear how she makes decisions and when she uses critical thinking skills, because everything in textbooks very often is very algorithmic. You do A, B, C, and D, this is what happens. But to hear the real life, you are making decisions, you are making assessments. Everything, especially in an emergency department, doesn't always fit into a box. Yes, we need standardization and reducing variability, but also that patient individuality is critically important as well. So they really enjoyed hearing about that. They also have reached out and asked for, so one of the students is she was the head of the student organization, and she's had a couple of the staff speakers come and speak to the student nurses, even taking that forward, especially the safe nurses. They were very excited to hear about that process, how we're supporting victims of assault. And we don't talk about that very often. We don't see what happens in emergency departments because rightfully so. It's, a private situation. but they were very interested in hearing that. And they were very interested in sharing with students how we're doing that.
Any closing thoughts as we wrap up this episode?
It's very important that we remain vigilant in thinking of new and innovative ways to support our workforce. I believe, and I think we can all say, the world has changed since COVID, and it requires more innovation, different levels of partnership. And I think an academic practice partnership is good for both organizations as well as schools. Organizations need to retain their nurses. It's the right thing to do for the patients, as well as the organizational finances. But the schools of nursing also want to make sure that they are having their students successfully employed after graduation. So this is a win-win. And the person that really wins the most out of these partnerships truly are the patients, because we are able to ensure an improved workforce, a better prepared workforce, and therefore patient safety is improved.
The title of the peer-reviewed manuscript is Pathway to Emergency Nursing, an Innovative Academic Practice Partnership. It is available online and also in Nurse Leader. Dr. Linda Zeman, thank you so much for your time. I appreciate you talking to us today about academic practice partnerships in the specialty.
Thank you, Nick. It was my pleasure.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.